Welcome to Humanautic, unlocking the secrets inside your body and brain. Today's topic is not about a single operation. It is about how to think safely in surgery. Procedures change. Instruments change. But surgical principles do not. If you master these principles early, you will be safer in the OT than someone who only memorizes steps. Principle 1. Correct patient, procedure, and site. The first step of surgery is verification, not incision. Always confirm. 1. Patient identity. 2. Procedure plan. 3. Side and site never assume, even for routine cases. A technically perfect surgery on the wrong site is still a catastrophic error. And remember, final responsibility is always the surgeon's, not the checklist. Principle 2. Adequate exposure before dissection. Most surgical injuries occur due to poor exposure, not lack of skill. Safe surgery requires correct incision, adequate retraction, clear visualization. If you cannot see clearly, do not cut. Do not clamp. Do not cauterize. Rule: identify structures before dividing them, never the reverse. Principle 3. Respect for tissues. Tissues remember trauma. Safe tissue handling includes 1. Gentle traction. 2. Minimal crushing. 3. Sharp dissection when required. 4. Preservation of blood supply. Rough handling leads to edema, necrosis, infection, and poor healing. Good surgeons are efficient. Great surgeons are gentle. Principle 4. Hemostasis is mandatory. Bleeding obscures anatomy, and obscured anatomy leads to injury. Hemostasis should be early, continuous, definitive. Never clamp blindly. Identify the source before controlling it. Poor intraoperative hemostasis often presents later as postoperative complications. Principle 5. Know normal anatomy before calling pathology. You cannot recognize abnormal anatomy without understanding the normal. Before dividing any structure, ask: 1. What is this structure? 2. Where does it come from? 3. What lies deep to it? Most iatrogenic injuries occur due to misidentification, not ignorance. Surgery is applied anatomy, not memorization. Principle 6. Anticipate complications. Safe surgeons think one step ahead. Before each step, anticipate bleeding, nerve injury, organ damage. Ask yourself, what can go wrong here, and how will I manage it? Prepared surgeons rarely panic. Principle 7. Do not force surgery, change strategy. When surgery becomes difficult: 1. Stop. 2. Reassess. 3. Improve exposure. 4. Modify your approach. Forcing progress leads to bleeding, tears, and nerve injury. There is no shame in pausing. There is danger in ego-driven surgery. Principle 8. Closure, counts, and communication. Safe surgery does not end with skin closure. Always ensure to check the instrument and sponge counts. Clear documentation. Proper post-operative orders and handover. Many complications occur after surgery, not during it. The surgical mindset. To summarize, safe surgery prioritizes: 1. Planning over speed. 2. Visualization over force. 3. Principles over ego. Master these fundamentals, and procedures will follow naturally. Great surgeons operate with their minds before their hands. And if you like this kind of videos, don't forget to like, share and subscribe to Humanautic channel, where we explore the human body inside out. And also mention in the comments, on which topic should I make the next video.